traditionally the health sector has led the development of the process without much involvement and ownership from other sectors, except perhaps for education. The evidence base was not sometimes comprehensive or up to date, even when we were talking about the diet nutrition outcomes relationships. And we have found also that there has been limited transparency, so the current processes are not to develop dietary guidelines are not usually disclosed. We don't know how the evidence has been translated into dietary recommendations in many of these national dietary guidelines. And there has been an overemphasis on the messages as being the dietary guidelines. So even though the evidence exists that the messages alone will not lead to a change in consumer behavior, but still we find that in most countries, there is overemphasis on the messages. Monitoring and evaluation, we found out that this has been lacking. So we used all these observations and results of our analysis to think, what can we do next? So we came to the conclusion that a revisit of the way the dietary guidelines have been developed needs to be really taken. And this is where we started working with countries, with experts from very well-known and respected experts in their fields. We undertook a survey to understand what the problems were at country level. So we started putting our thoughts together to develop a new methodology, that can link the nutritional priorities at country level to the food system, to the local food system, where these dietary guidelines should be really uptaken by consumers. Why? Because we saw this disconnect between the dietary guidelines and the food systems, and we thought if we don't revisit the methodology, we will not be able to achieve this potential or this possibility of making the dietary guidelines a lever of change for the food systems. So we embarked on this journey in 2018. We undertook a survey, as I said, a global one. We organized a number of expert consultations. We engaged with experts to help us in defining better this methodology. So we came up with a new methodology that will be presented to you today, and I'm happy that Ramani is in Malawi, and she will be taking us through the new methodology. And a few things about the new methodology. This new methodology has many innovative aspects. So it is underpinned by a coherent theory of change, anchored in a food systems approach that takes as reference the food systems framework for better nutrition that was developed by the high-level panel of experts on food and nutrition of the Committee of World Food Security. So we are linking our thinking to the food system in all its components, let's say, and then we are linking also to underlying drivers of change. So we are taking also as a reference the guiding principles of sustainable healthy diets that help us integrate the aspects of health and nutrition, the aspects of environmental sustainability, and the aspects also of sociocultural sustainability. So we have seen in the last 10 years attempts by countries or also a change of thinking by countries to integrate some aspects of sustainability in their dietary guidelines. However, we also have found that the processes used or the methodology used was not shared, and it's not common to all countries. So we thought that a global methodology capable of being adapted to the local context was necessary. So this is where this is how we started. And we came up with this methodology that promotes and strengthens multi-stakeholder, multi-sectoral, multidisciplinary engagements to enable the development and implementation of dietary guidelines through a food systems approach. We have linked the nutrition priorities at country level, or we're providing guidance on how to link nutrition priorities to countries' food systems through a targeted analysis of food systems to increase the relevance of the dietary guidelines, their usability and contribution to systemic change. This all has been aided by developing new software to help countries do their diet modeling. And as I said, the methodology integrates different aspects of sustainability, and implementation is considered from the start. I will stop here because Ramani will be taking us through the theory of change, through the stages of this methodology, and focusing on all the innovative aspects of this new methodology. Thank you. Over to you, Ramani.
Thank you, Fatima. I have to say one of our speakers unfortunately has to leave at 6 o'clock, but we have a recording from her. Could we have the slides back on, please? Okay. I think I'm probably going to skip a couple of my slides because Fatima's already told you about some of the things I was going to say, and sort of to see if we can have Professor Alexandra still present before she leaves. Okay, now skip the slide. Okay, so yeah, so this was the plan, that we would have a short introduction on the methodology, and then we were going to hear the experience from Montenegro, Ghana, and Mexico on different stages of this methodology, and hopefully have at least 15-20 minutes for discussion. So I'll try to be a bit fast so that we can try to follow this. Okay, so you've already heard the title, FAO's Food Systems-Based Dietary Guidelines Methodology. Those of you who are used to working with dietary guidelines may have been wondering, what are these food systems-based dietary guidelines? Why no longer food-based dietary guidelines? But I think Fatima has really given us a good background on why this change came about. So I'm going to skip that. I'm also going to skip this slide, which gives you an idea of the timeline of dietary guidelines. But probably what I should mention here is that there has been renewed interest in dietary guidelines, not only to address nutrition and health, but also to address the outcome of the environment. So for both planetary health and human health. And there is currently renewed interest in this. And countries, as part of their game-changing solutions in their country roadmaps for food systems transformation, are looking at dietary guidelines as well as part of after the UN Food Systems Summit. And I think Fatima gave you a good background of how we've been working on this new methodology. And I should also add that it has been guided also by experts, and some of them are here in the room, who participated in expert consultations we've had and contributed to this, as well as from the experience we've had supporting countries. So we've supported over 30 countries since 2016 to either develop, revise, or implement their guidelines, and all this has gone into the process. Okay, so this process, this theory of change is, there is a theory of change that underpins this methodology. And I think Fatima mentioned it's based on the HLPE. So I'll just guide you through that. I don't know if you can read it, and I think I might have to move down. Is it possible to have the little mic? Because I can't, I'm short-sighted. Okay, so the inputs to the process, the inputs are actually the process of developing food systems-based dietary guidelines. And then you have the outputs, which are at 3 different levels. At the first level, you have the policies and programs mapping, and you have a stakeholder mapping. Then you have a comprehensive situation analysis and evidence. Thanks, Megan. Okay, great. Okay, I'll try not to fall off the stage. You have you have the situation analysis, there's a targeted food systems analysis, and then there is diet modeling to come up with optimized dietary patterns, but I'll speak more on this later. At the next level, you have multi-level technical recommendations being developed. So you still have dietary recommendations, which are similar to the dietary messages, the food-based dietary guidelines messages that you might be familiar with. But it doesn't stop there. We also have enabling food supply, food environment, and consumer behavior interventions. Then in the next stage, you have a food systems-wide implementation plan being developed. Yeah, maybe I'll try and read that. Yes, okay, I'm really short-sighted, that's a problem. Okay, you have the food systems, maybe I'll come down, okay. All right, okay. So you have a monitoring and evaluation framework, and of course, information, education, and communication materials. This is supposed to lead to two outcomes, intermediate level and long term. And at intermediate level, the hope is that legislation, policies, programs throughout the food system will be developed and reviewed and implemented in alignment with the FSBDGs. And that there will be increased commitment, capacities, and collaboration of all food supply and food environment actors and consumers who will be willing and able to take actions that align with the FSBDGs. The long-term outcomes, there's 3 of them, and they lead into each other, as the green arrows show. One of them is that food systems will be shaped by coherent policies and programs that promote healthy diets and sustainability. The coordinated response of food system actors will increase access to healthy diets from sustainable food systems, and that consumers' diets and food practices will be aligned with the food systems-based dietary guidelines. The sought-after impact is improved diets, better nutrition, and more sustainable food systems, which will also then hopefully lead to impact at the level of some of the SDGs. Like most theories of change, this one also is based on assumptions. I'm not going to read them all, but 2 of the key ones are that there will be a political will and commitment for this to happen, and that there will be sufficient and continuous resources, so human resources, funding, as well as time. No, sorry. I forgot to mention the cross-cutting elements, which are in dark gray. Fatima already mentioned about the multi-stakeholder, multi-sectoral engagement. And this is something that we've really been stressing with countries we are working with, because traditionally it's been strongly health sector focused. And if we really want these dietary guidelines to go beyond the health sector, then right from the start, you need to involve a multi-sectoral group. There's capacity development, which happens across the process, and sustainability is integrated right from the start throughout the process, and all dimensions of sustainability, as Fatima mentioned. And then finally, monitoring and evaluation, because a question that we often get is that dietary guidelines have been around for so long, and is there any evidence that they work anywhere? So we are hoping that with this new methodology, countries will put in more effort to actually monitoring and evaluating their dietary guidelines as well. I think Fatima touched on this, so I'm going to skip over it. This is the potential of dietary guidelines, and I think it will suffice to say we hope with this new methodology that dietary guidelines will be able to inform and guide policymaker actions, and not just be there to be used for nutrition education or to inform and encourage individuals. Okay. So these are the stages of the new methodology. I'm going to tell you in detail about 3 of them. So stage 1 is where the design and planning of the national process occurs. And it includes setting up the organizational structure, identifying the mandate, and developing a work plan. So you would have a lead entity. In our experience, it tends to be either the Ministry of Health or Ministry of Agriculture, though sometimes they might work together, which is really nice. You have a steering committee made up of a few key stakeholders, and you have a technical task team, which is multi-sectoral. And that's the point, that it's at that point that you try to get a broad group of experts in the room all the time. So you would have the relevant ministries that need to be involved, but you also have academia, you have civil society, usually you have the UN organizations, other NGOs, everyone involved. Okay, then in the second stage, you have the situation and analysis and evidence review. And this again, Fatima touched on it, we try to go much broader than what has been done up to now. So we go much broader than just looking at health and nutrition. It starts off with a targeted policy and program review so that you get an idea of what's already happening in the country and what are the priorities, so that the food systems-based dietary guidelines can try to target those as well, if it's relevant. Like with the previous process, you describe the priority health and nutrition issues, you look at the diet-health relationships, you look at any gaps in the diet. You describe diets in terms of dietary patterns, and you set preliminary dietary goals and targets. And then here is what is new. You have a targeted analysis along the food system. So you try to then link these dietary problems that you have to what is causing it in the food system. And then you're going to try and address that as well without just trying to address diets. And all this results in what we call the SIRE, the Situation Analysis and Evidence Review Report. Okay, then you come to stage 3, where you develop recommended dietary patterns and formulate the multi-level technical recommendations. And at this stage, the countries that we work with typically carry out diet modeling, where they work with the dietary goals that have been set in stage 2, and they try to see if these are feasible. And at this stage, you would also see if these dietary recommendations that are coming out, not only that they would fit, they would fulfill nutrient requirements, but they would also fulfill any cultural acceptability requirements, any environmental constraints that you have set, or cost constraints, depending on the data that the country has had and their priorities. Then you formulate the multi-level technical recommendations, which cover diets, enabling food system interventions both, and you validate and you finalize. As Fatima mentioned, this is the HLPE 2020 framework, and it's strongly based on this. So what we do with the technical recommendations is you have the dark brown box, which is the diets. But in order to affect the diets, we are also going to focus on consumer behaviors, food supply chains, and the food environment. So the middle section of this. Okay, so this is what a multi-level technical recommendation looks like. So let's say you have a dietary goal which covers fruit and vegetable intake. So this is a quantifiable recommendation here. You would look at consumer behavior interventions that would promote this. These are just two examples that we put, but the important thing is that these would be based on actual evidence of interventions that have been shown to work, ideally for that country or within that context. So for example, maybe there was a mass media campaign using social media, which had some actual result, and the country will decide to try and scale this up as part of the dietary guidelines then. There would be a food environment actions as well. So for example, provision of food vouchers. And there would be food supply chain actions. So maybe the evidence review found that the horticultural sector needs strengthening. So that would be something that's added. So as you can see, it's no longer just a dietary message. It's no longer just a dietary guidelines message, but it also covers food system actions, which are strongly backed by evidence. Okay, so going back to the stages of the methodology, as I said, there are 6 stages, and we are currently in the process of finalizing and putting out up to stage 3. But at the same time, we want to stress that with countries, we want countries to think right from the start up to the implementation, because often it happens that countries spend a lot of energy to develop the guidelines, and then you have a change of government, or you have a change of whoever the staff were involved, and then they don't use these. So we are really putting a lot of effort to make them think of implementation and work towards that. Very briefly, in stage 4, the implementation strategy along the food system is developed. Stage 5 is for developing all the materials that are needed that would target branding, advocacy for training and capacity development, and nutrition education and promotion. And then in stage 6, you actually implement, and you have the training of implementers, you have the monitoring, evaluation, and improvement. That's all from me. Let me see. No, sorry, my key messages. Okay, so very quickly, my key messages. I'll go up there again. Okay, so food systems-based dietary guidelines can promote healthy diets from sustainable food systems by informing policies and programs throughout the food system. Dietary guidelines need to integrate sustainability considerations and a food systems approach in order to unleash their true potential. Countries have shown keen interest in dietary guidelines as a game-changing solution. FAO is currently finalizing the new methodology manual to bring about new ways of thinking and acting about diets and food systems. And thank you. Okay, I would like to invite Professor Alexandra Martinovic from the Faculty of Food Technology, Food Safety and Ecology in Montenegro. Unfortunately, Professor Alexandra was supposed to leave soon, but I wonder if you're still online, Alexandra. Are you still there? Anna, do you know if Alexandra is still there?
Yes, just a second.
Okay, great. Okay, please go ahead then. Okay, great, perfect. Okay, go ahead, Alexandra.
Okay, hello everyone. My name is Alexandra and I'm from Montenegro. I'm a Dean of the Faculty of Food Technology, Food Safety and Ecology. And I'm also Director of the Center for Food Safety and Quality, Center of Excellence for Food Safety and Quality in our country. In this matter, I'm involved as a national contact point for this project, and I will shortly explain the steps that we were undertaking in Montenegro with regards of the establishment of national food system-based dietary guidelines. So maybe the previous slide, the slide before this one. So the whole initiative was, of course, supported by FAO in Montenegro, and we have been following the steps according to the methodology defined by FAO, where we have first initiated the involvement of the specific, let's say, the authority that will be engaged in the process. And as we identified, the main authority in Montenegro for this purpose is Institute of Public Health, actually Ministry of Health, but together with the Ministry of Agriculture. So FAO is providing a tailored technical support, and this was of high importance for us, where we were able, with the help of FAO, to understand the methodology and to understand all the steps that are necessary to implement the guidelines. So the first initial activities were actually the key activities concerning the review of the status of this issue in Montenegro, then the possible stakeholders, then of course the institution that will lead all the process or support the process, etc. So therefore we have organized a national workshop, the first national workshop in December of 2022, where we have invited all interested stakeholders, and then we use this opportunity also to appoint the national coordinator. The role of the national coordinator, which is in Montenegro, Dr. Enisa Kujundžić, should be that she has the expertise in this area and that she helps and supports the process that is going on. Another thing that we have managed to gain during this process is also the strong governmental support, primarily from the Ministry of Health and Ministry of Agriculture. Then the next step was, of course, stakeholder mapping. So the workshop that was held in the first workshop really helped in the mapping of the interested or involved stakeholders, and we have encountered a very huge interest from all of the identified stakeholders in Montenegro for this issue. So they were all expressing the willingness to be the part of this initiative. Then, of course, during this workshop, every step of the way was explained truly to the stakeholders. And at the end, we identified 32 relevant stakeholders in the country, including governmental agencies, universities and schools, representatives of the civil sector, laboratories, research institutions, etc. So the objectives of the workshop was, of course, to create awareness about the importance of the development of national food system-based dietary guidelines, then to seek to approve and confirm the multisectorial support, to introduce FAO methodology, and to prepare the roadmap of the implementation of the guidelines and the whole system. And of course, the nutrition and food system overview. So in the meanwhile, we were working hard to get all available data in Montenegro concerning the nutrition, concerning the systems that are behind this. And then we have been summarizing this into a report that will also be the part of a SIRE report at the end of this stage. The workshop lasted for 2 days, and of course the FAO representatives were present, and they had also the in-depth explanation of the whole steps and the activities. As a result of the workshop, we have managed to establish the steering committee. And the steering committee that will supervise, together with the national coordinator, all the activities here in Montenegro. And then another very important issue and the step is that we have managed to found the task team, group that is comprised out of all the experts and all the stakeholders. And what is important with this task team is the fact that we have divided the people according to their expertise into different working groups. So we have defined in total 4 working groups, one that is related to public health, the second related to agriculture, food safety, then the third related to nutrition, and the 4th related to the communication in dissemination. So in this sense, we have established the work of the group, and we then now can proceed to the elaboration of the situation analysis report, and of course continue with the further steps in the process. So as a summary, I can say that this initiative is very important for Montenegro, that we have a global consensus of all the stakeholders in the country, and the broad participation, which is a strong guarantee of the success. And of course, that we have the awareness and ability of all the stakeholders to understand the importance of such initiative and the importance for the country in general. So this was shortly the explanation of the process. I hope that I was clear enough. And of course, for any questions, I kindly stay at your disposal.
Thank you very much, Alexandra, and thank you also for respecting the time. Since Alexandra has to go, I'm wondering, does anyone have any questions you would like to ask her? We were going to save the questions for the end, but she's not going to be able to stay till the end. Does anyone have any questions at all? Oh, it was perfectly clear. Okay, maybe I will ask Alexandra one question myself that I had for her, and then we can go ahead. Alexandra, countries sometimes struggle with ensuring true multi-sectoral involvement. What has been your experience of this so far with the dietary guidelines process in Montenegro? Has it always gone smoothly? Has this multi-sectoral collaboration been easy to achieve, or what are some of the challenges? Thanks.
So this is actually the process that is somehow maybe easier in Montenegro than in other countries in terms of the size of the country. So we are quite small country, and we are using this advantage in a way that everyone knows everyone, so we can easily gather people. Another very important issue is that the people that are in the field are aware of the importance of this issue, and they are really willing to participate. Another thing that we have also tried is to find additional funding sources in the country and through some project applications in order to facilitate the process of participation and to involve as many stakeholders as possible. So we will see the outcome, but so far almost everyone is showing the dedication. Of course, time can be sometimes an issue. For example, we were waiting for some time the data from the statistical office of Montenegro. This was time consuming, but finally we got it. So in the essence, everybody is very prone and positive towards the idea and the process. The rule book, when we are talking about the rule book, we were sitting together and developing the rule book for the work of the task teams and also the work of the steering committee. In the essence, the rule book as a document is quite, let's say, task-oriented in a way. So, but it arranges the work within a different body in a nice way. Through the articles, through the membership that is already defined, and to the responsibilities. So then we have sort of a written consent from all of the participants of the task team. We had last week the first meeting of the task team, and by participating, they have consent on their rule book, and of course they have shown the consent to be dedicated to this issue. In this sense, this is also somehow formally regulated, not by law, but by a goodwill, and of course a little bit of writing in a written document that everybody agreed on. So the rule book I can share also if someone is interested, but it's a basic rule book arranging the work of any work group or any body like the steering committee, etc.
Thank you so much for joining us. Then we'll go ahead then to Paulina Eddy, who is the Director for Women in Agricultural Development Directorate, Ministry of Food and Agriculture, Ghana.
Thank you very much. And I don't know whether to say good evening or good afternoon, but greetings from Ghana. My name is Paulina Eddy, and I work with the Ministry of Food and Agriculture, Women in Agricultural Development Directorate. And for developing the food systems-based guidelines, I had to lead the multi-sectorial team with a colleague from the School of Public Health, University of Ghana. Next slide, please. Yes, so we had to also flow with the FAO prescription on the process. So as has been said already, we also went through the same stages, but then it took us 6 years to get to the point 8, which is the point of dissemination. We are now going through our implementation processes, validation, and so on. And then, of course, we'll carry out monitoring and evaluation. For our dietary guidelines, we targeted 5 years and older, even including the aged along the life cycle and those with challenges related to severe malnutrition. Next slide, please. Yes, so if I would have to give an example of the key recommendations in our dietary guidelines, I can talk about one of them, which is eating a variety of fruits every day. And we know that in Ghana, we do not eat adequate fruits, but then we are emphasizing that we should have at least 2 servings of fruits that are in season. And we are promoting diversity as much as possible and using the colors to also guide consumption. And then we also emphasize when to eat, the handling, because food safety is very crucial to us, and then how to eat, and then the benefits that we get from eating the fruits with all this information. Ability issues that will enable us access the fruits that are in season in order to consume them. And we need to also whip up the promotion on the consumption of our foods as part of our food service in various meal setups, in various institutional level food intake and related. So that is just an example of the technical recommendation of eating a variety of fruits every day. And then for the evidence, yes, we started with a review of agricultural, nutrition, social protection policies, among others, because that forms the basis to know what is available within the space, what the nutrition issues are, and the others. And then we also have statistics on nutrition issues like overweight, deaths from non-communicable diseases, multi-level deprivation levels of poverty at both the rural and the urban levels. These were all clearly stated. And then analyzing food groups and consumption levels for us to do our prioritizing. And then we got into the diet modeling. So from this, we are able to make key recommendations in order to avert the issues related to deaths or other issues related to the non-communicable diseases, which are all food related. And then for the multi-sectoral team, yes, these are the institutions involved, and that is where we made our decisions. Because I hinted earlier on that we have relative expertise, and this is where the heartbeat of this decision-making process occurred. You can see the universities, the Development Planning Commission that has an overarching coordinating role to see to policy coherence. And then we also have academia, statistics, education, health, agriculture, and the rest, as you can see on the slide. Now, with implementation, we ask ourselves how the guidelines will be used. And first of all, we have to integrate them into our programs and plans, and then make sure we have dedicated funds or ring-fence some funds to promote nutrition education. The next is to use it as a tool to build capacity and also for advocacy and for use by various NGOs or civil society organizations to reach out to policymakers to commit to supporting the implementation process. And then also we will be hinging on the social media handles to enhance the promotion of the food systems or food-based dietary guidelines in Ghana. If we have any message to give out or give away, we would want to encourage other countries that are at the stage of developing their food-based dietary guidelines to compose a multi-sectoral team as we did and follow the process prescribed by FAO, work with evidence which is compelling and goes beyond nutrition and the health domains, and also have supportive guidelines which is easy to follow. And I guess we will all have a well-nourished nation and an Africa full of healthy people as we all want. Thank you very much.
Okay, thank you very much. And if we can get the PowerPoint up again, and hopefully our last speaker is from Mexico. If we get the master PowerPoint up again, please. And if you allow ANH2023 from Mexico to speak. We've had a slight change because we were supposed to be joined by Dr. Annabelle Bonvecchio, the Director of Research in Nutrition and Policies at the National Institute of Public Health, but she was called away at the last moment, but her colleague Anna has very kindly stepped in. Okay. Anna, can you hear us? Are you online?
Yes, I'm here.
Oh, great. Yes, we can hear you. Please go ahead then.
Well, good morning, good afternoon, and good evening, everyone. I will briefly present to you on our work from a collaboration with FAO that we had last year. Oh, thank you, Anna. And also from within our own country experience in developing our dietary guidelines, which we have just released 2 months ago. And this work is specifically on stage 4 that Romani talked to us before, and is towards developing an implementation strategy with a food systems approach. Next one, please. So the first thing we did was review the evidence to see what barriers and opportunities were there for a multi-sectoral implementation. So we planned and developed a protocol for a systematic review to identify actions, priorities, best practices, and barriers to improving food system-based dietary guidelines implementation in all sectors. We did review the evidence back to when the first International Conference of Nutrition to November 2022, and we included all types of interventions, particularly any effort of action in any selected sectors with different contexts and in any population group, including policies, program, procedures, or services. So we reviewed the full text of almost 600 studies and included 136 with different designs. 40 countries were included, 11 studies were multi-country. So from these, most of them were developed in high-income countries, but low and middle-income countries were also included. So what we found were that the main barriers for implementation, I have to say most studies were published in school settings, but all different sectors, clinic settings, cafeterias, policies, programs. It was a great variety of settings. We found that the main barriers for implementation were lack of or shortage for knowledge and skills, lack of self-efficacy, limited resources, and the perception that the policy of the guidelines or the guidelines would limit the ability to achieve benefits, and also lack of capacity building. And we also documented good practices from this review, and we found that having a cost-benefit analysis was a good practice, along with proposing corrective actions to identify problems, also setting short and long-term SMART objectives, targets, and priorities, and also indicators were good practices across all the sectors included. Having a public consensus document by government and key stakeholders, formal policy mechanism, linking the implementation strategy to existing national programs and priorities to increase the feasibility and minimize costs, and adopting a comprehensive, holistic, evidence-based approach were also good practices that we documented from this review. Next, please. Thank you. So after this review, we followed developing a guide that could help countries their own implementation plans. So we developed a checklist based on the Scaling Up Nutrition Zone checklist, which is a criteria and includes criteria and characteristics of good national nutrition plans. We also based this checklist on the Consolidated Framework for Implementation Research and on wealth and collaborator evidence, which they gather doing a survey with experts to gather inputs to address barriers and implementation strategies, and our own systematic review. Next, please. So we developed this checklist that contains 3 components. I'm going to focus on component 1 and 2. Component 1 regards the context definition, policy and program analysis. This component has 3 criterions. So we propose that the implementation plan should have the strategy should be aligned with and based on the situational and context analysis, including the regulatory framework, policies and programs, which inform the development of the technical recommendations. Criterion 2 is the strategy briefly describes the process of developing or updating dietary guidelines and the importance of their multi-sectoral implementation. And criterion 3 in this same component is that the strategy defines goals, objectives, and processes for implementation planning and implementation of the food-based dietary guidelines. As one example of these criterions, I can say the strategy aligns with and is based on countries' epidemiological and nutritional context analysis. The regulatory and policy framework analysis is relevant to the food system-based dietary guidelines, including the complementaries and overlaps with other national or local programs. I'm going to go fast. Component 2 is about the process for developing the actual implementation strategy. And this component has 4 criterions. The first one, the strategy explains the multi-sectoral structure established to develop the implementation strategy and its respective management, coordination, and implementation. The second criterion in this component, the strategy describes the organizational capacity gaps at a sector or multi-sectoral level that need to be improved to implement the food-based dietary guidelines. The third criterion, the strategy includes an operational food system-based dietary guidelines implementation plan or roadmap, which considers existing capacities and financial resources, human resources, and even technical capacities. And the last criterion in this component is that the strategy includes a monitoring and evaluation plan for the food-based dietary guideline multi-sectoral implementation. So this should be planned ahead. Component 3 is the monitoring and evaluation plan with 2 criteria. The first criterion is that the strategy has a mechanism to provide adequate feedback and dissemination of the food-based dietary guidelines multi-sectoral implementation. And the second criterion for this component, this last component, is that the strategy presents the budget and describes the accountability mechanisms for the food-based dietary guidelines multi-sectoral implementation plan. As an example, it includes a mechanism for documenting good practices and lessons learned from within this whole process. Next, please. In Mexico, experience from our own country experience, we aim to identify policies and programs that could align with the dietary guidelines for the Mexican population and obtain information on inputs for implementation. So what we tried to do is we carried out 2 exercises. First, we prepare an inventory of possible policies and programs in the country that had the potential to be aligned with the food-based dietary guidelines. And then we planned a policy group exercise based on public policy cycle perspective. Next, please. So for the first part, the policies and programs inventory, what we did is we prepared an online survey and an online review. the online survey, we tried to inquire about potential programs and policies known to various sectors, which was shared with all expertise committees and the multisectoral committee members. And we did an online review on we searched web pages of relevant sectors and institutions regarding what were their current programs and policies. So as a result, we found, we compiled 38 policies and programs that had the potential, we consider they had the potential to be aligned with the food system-based dietary guidelines. And they were concentrated mainly on health, agriculture, livestock education, and economy. And second, we had this policy group I was telling you about, where we had a virtual meeting during the process of the 2-year process we had in developing our new guidelines. And we used a group map as a collaborative tool. We had 44 specialists from 21 institutions from different sectors. And the purpose of this group was to work collaboratively to identify elements to promote food system-based dietary guidelines implementation and to identify the main challenges and alternative solutions for these challenges, for the integration into different national policies, programs, and legal instruments. And we also confirmed with them that the actual inventory we had found through the online survey and through the online review was accurate. As a result, we ended up having a list of policies with the most significant contribution to the achievement of the food system-based dietary guidelines objectives, policies, programs, and guidelines that had not been previously included and that should be considered in the implementation plan were there. We had an analysis of the feasibility of implementing the priority list with them by discussing with them and the challenges and alternative solutions to address them and to promote implementation. Next, please. So as key findings, we realized that it's time to start thinking about implementing dietary guidelines, which also implies integrating them into national policies and programs, including using them to inform them. Key success to implementation include intersectoral coordination, stakeholders' knowledge and capacity, resources, and monitoring and evaluation. Most barriers were found in the pre-implementation and implementation planning stages, which shows the importance of strengthening countries' capacities during this preparation stage. Both the inventory of policies and programs and the policy group provide an important input for the construction of a multisectoral implementation plan for the food system-based dietary guidance in our country. Thank you.
Okay, thank you very much, Anna. We've sort of reached 1 hour, but thank you very much. I think we need to wrap up now because I'm aware we've gone 20 minutes over time despite starting late. Unless there's any sort of burning question on the chat, maybe Anna, I can invite you to give the closing remarks. Okay, so Anna Islas Ramos is a nutrition officer at FAO, and she leads our dietary guidelines work. So Anna, please give the final word. Thanks.
Thank you all. So I would like to start these closing remarks with 2 questions for you. What did you eat for lunch today? And how did global, national, and local food systems, that is the food supply, the food environment, and your individual characteristics and capacities influence what you ate? Any comments? So, as you heard today, for many years now, in many fora, dietary guidelines have been asked to inform policies and programs. However, to a broad extent, this has not happened. With increased attention on the role of food systems to influence diets and of diets to influence food systems, this call to inform policies and programs has become louder. Also, in the era of the SDGs, it has been highlighted how what we eat is interlinked with sustainability, and therefore the need for dietary guidelines to integrate sustainability. So, dietary guidelines have been underutilized. They need to be better developed, communicated, implemented, and evaluated to unpack their potential and inform policies and programs all along food systems. Today, we heard from Montenegro how, according to their priorities, they have expanded their stakeholders and areas of expertise in their process as they start to develop dietary guidelines with a food systems approach. We also heard the process of Ghana that they followed and how they developed and planned to use their multi-level technical recommendations, the food system guidelines for Ghana. Finally, we listened to the results of a collaboration between FAO and the National Institute of Public Health in Mexico on how dietary guidelines implementation can be strengthened, and Mexico's own experience in identifying policies and programs that could align with the Mexican dietary guidelines. Through the new FAO food system-based dietary guidelines methodology, we seek to support countries in developing and implementing dietary guidelines that can effectively inform food system transformation for healthy diets and sustainability. The time has come to unleash the potential of dietary guidelines. We would like to thank our speakers today and thank you all for joining this event.